Hi, I'm Ed Spilg, and I'm an AMS Phoenix Fellow 2016. I'd started doing this project with the intention of trying to study and understand more about what compassionate care is and what it means both to patients and to physicians alike. As part of my journey, I've developed an interest in the physician, and particularly with regards to the physician's wellness. I created this project to be able to study both facets, physician wellness and burnout on the one hand, and the delivery of compassionate care on the other hand. Most physicians go into the practice of medicine in order to deliver compassionate care, but the stresses and oftentimes the challenges that many physicians face in the workplace leads to increased stress, anxiety, and sometimes burnout. So what does burnout mean? Burnout means that the physician becomes emotionally exhausted. They start to become more cynical and less motivated. And they lose the personal accomplishment that's so important and is such an integral part of the practice of medicine. So, how do you build a community of practice? Well, the first thing is you start to get people talking about the problem. There's no shame in talking about wellness, and there's certainly no shame or stigma talking about burnout. But many people perceive that the subject is one about their mental health, and there are many adverse stigma around such discussions in the medical profession. But if we can turn it from a negative to a positive, if we can start to help physicians understand that they have the ability within themselves, and if they work together as a group, they can build their own resilience, and they can build the resilience of the group. I have a leadership role within my Department of Medicine at the University of Ottawa. I'm the first Vice Chair for Wellness and Professional Development. That puts me in the unique position to lay the infrastructure and the groundwork to implement an intervention. And one of the key aspects of my project, funded through AMS Phoenix, is to try and develop that community of practice within my physician colleagues in my hospital. Because I believe that it's only through that process are they really going to be able to not just be empathic towards their patients, but have the self-compassion that's required towards themselves and the compassion towards their colleagues to deliver the quality of care that patients so desire and require. The AMS Phoenix project has given me a platform on which to build networks and to connect with key stakeholders, particularly within my organization, both the Ottawa Hospital and the University of Ottawa. That's allowed me to work with colleagues across many different disciplines, not just physician colleagues, to be able to have the conversation about why wellness matters. Networking with these key stakeholders within the organization in which I practice allows me to put the delivery of compassionate care at the top of the priority list. The delivery of compassionate care is something we can't ignore as providers of healthcare. It is our core business.